Good afternoon, and welcome to our healthcare talk on behalf of the YWCA. I would like to start out by giving a land acknowledgement. The YWCA of the Lower Cape Fear serves the people located within the Cape Fear region. This land once thrived with life from indigenous people, known today as the Cape Fear Indians, and the YWCA Indian people. Living in established settlements along the Cape Fear River and Lake Waccamaw, along with many other established sites in the region. We need to protect and honor the history of these places. Indigenous people are not relics of the past. They are still here, continuing to demonstrate their talents and gifts amidst a backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Today, we are going to talk about the COVID-19 vaccine. Longstanding systemic health and social inequities have put many people from racial and ethnic minorities at increased risk of getting sick and dying from COVID-19. There's increasing evidence that some racial and ethnic minority groups are being disproportionately affected by COVID-19. Inequities in the social determinants of health, such as poverty and healthcare access, affecting these groups are interrelated and influence a wide range of health and quality of life outcomes and risk. Some of the factors that increase the risk of getting sick and dying of COVID-19 include discrimination, healthcare access and utilization, occupations such as essential workers and frontline workers, educational, income and wealth gaps, and housing. These are the same factors that increase patients' risk of developing illnesses that make a COVID-19 infection even more deadly and cause poor outcomes. Today, we are here to discuss the vaccine and answer questions. Based on the information shared above, I believe that the COVID-19 vaccine is an opportunity for these communities I've mentioned. Joining me today, we have Dr. Latonya Beatty and Miss Evelyn Bryant. Miss Carla Turner from the New Hanover County Health Department was supposed to be here, but she had to leave on an emergency. So any questions that we have related to the specifics of New Hanover County will have to be answered at a later date. Thank you very much. Hello, Dr. Beatty.
Hello.
We're going to start out with some questions that we have received. The first question that we have is, what is herd immunity?
I can answer that. So I'm Dr. Beatty, one of the family physicians at MedNorth, and I'm also a native. I grew up in Columbus County. A lot of people do know me. So to answer the question for herd immunity is community immunity, where a large percentage in the population have been immune to a virus or a specific disease, whether it's through vaccinations or past exposure. And the more people that are immune, then it decreases the risk of person-to-person spread. So the larger the percentage, the better. And then the closer that we can get to normal.
Okay, very good. Thank you. The next question we have is how does the country benefit from African American or other population subgroups with lower reported COVID-19 vaccine acceptability rates to take the vaccine?
Okay, kind of as mentioned before, with herd immunity, our goal is to get 70% vaccinated. And so according to the most recent statistics, there's like 60% of whites in our population. So if we have, so blacks make up 13%. So the more we get vaccinated, the closer we'll get to our goal with herd immunity. And then also, as you mentioned before, with the disparities, there's decreased chance of catching COVID or having a severe infection. As we see on the news, there's definitely been racial disparities with hospital admissions and then getting life-saving treatment. And so that's another benefit of getting the vaccine. And it also protects our health.
Thank you. What are some possible explanations that Blacks do not trust the vaccine? I don't know if Evelyn wanted to chime in on this one or not, but you can go ahead and answer to Dr. Beatty. Okay,
so 2 reasons I can think of in the past is the Tuskegee syphilis treatment. I know we all heard about that, where our Black men didn't know that they were exposed to syphilis. And then we have Henrietta Lack. She had cervical cancer. She was an African-American woman, and she didn't know that her cells was used for research. And as we probably heard from my ancestors, I know I did, especially my grandma on my mother's side. She said several times she didn't want to be used as a guinea pig. And then just racism in general, and then just the things that we went through with slavery. And so I definitely understand the mistrust. So
I've definitely heard some of those same sentiments among the African American community. Do you have anything to add, Evelyn, to this?
Yes, well, that is correct. A lot of the information that I've heard from the community is mistrust, but more importantly, how safe is the vaccine? I just had a community event this morning where we did a pilot program for seniors on the north side to vaccinate, do a drive-through vaccination. And prior to doing it, having the opportunity to speak with the elderly group, it was more so, you know, how safe is it? There's not enough information being told or given to them in order for them to, I guess, make a decision on whether or not to do it. So I think the information going out in the community is about the safety of it, and knowing and understanding that with the vaccine now with Pfizer, it's a round 2. So you take the first round and then within 3 weeks, you come back and take another round, and the availability of it. So a lot of the people that I've had communication with, it was more so, like I said, the safety and
we didn't hear that last part, Ms. Bryant, I'm sorry. So I would like to expand on that. People are really nervous about the fact that the vaccine was developed fast. But I had the opportunity to listen to some of the investigators from the NIH talk about the vaccine. And really, they have been working on these types of vaccines, coronaviruses, for years, but they didn't know when they were going to need to develop it into a full vaccine. So it wasn't really developed as quickly as it seems like it.
Right, I agree. I think with the prior research and the funding and just seeing how fast the number of cases with COVID this year and then the deaths, I think that's what sped it up. And that's what made me relax as well. And that's why I try to educate to my patients. I definitely can understand, you know, the hesitancy and how fast it was.
Right.
But I think the more we educate.
We've never seen anything like this, but then again, we've never lived through a pandemic. So.
Right.
Okay, the next question is, what can we do to build trust in the African American community about the vaccine?
I think the first thing is if you have a primary care provider that you trust, I definitely think talking with your primary care provider will help. And also social media, because a lot of our patients do rely on that. I think if they see more minority workers or just more people in general that get vaccinated and kind of report side effects, then they'll be more eager to get it. And then also, I think expanding to the communities, like maybe going to barbershops, churches, radio, or doing a podcast or newspaper clipping, I think that will help too. Kind of like what Evelyn was saying, the more education they get, the better.
The unfortunate part of going to churches right now is that churches are not meeting in person. So that definitely tends to make it a little bit more difficult.
Yeah.
Well, now most churches have a way of contacting their congregation. Right. And I think to your point, you're right, the educational piece. And, we have a lot of community organizations that are familiar with their community. So just keeping them informed of, okay, what are some things that or ways that you can inform your community? One of the problems that I had several weeks ago was a senior living facility. So some of the facilities, you can't go into, and especially the privately owned facilities. So how are they getting the information about COVID vaccinations, the education around it? If they don't have a primary care physician, then that's a difficult task also. So as we rely on social media and the news, not a lot of seniors have that, type of way of finding out the information. So I think it's imperative for our churches and our community organizations to get the message out, to get the word out, and be able to, as they say, take care of our own community.
Yes, and to caveat off that, I definitely think the church organizations, because I actually had a patient yesterday that was against the vaccine because it was mentioned in church that it was going to be a mark of the beast. And so after talking with me at his appointment, he now wants to get the vaccine.
Mm-hmm. Right.
And then another opportunity would be like social organizations, sororities and fraternities, doing talks and things like that too, to educate the public. So the next question is, what is the difference between the Moderna and the Pfizer vaccine?
And so with the Pfizer vaccine, both of them are 2 doses and they're very similar, like they're both messenger RNA viruses where it doesn't contain the virus. So that's definitely a misconception where patients think that, oh, I'm going to get the corona, because even I heard in my family, like, oh, you got the corona now. So that's not true. So the RNA messenger, the way it works is that it mimics the virus, but it's not the actual coronavirus, and it gives you antibodies to protect, to keep you from getting it. And so comparing those 2 vaccines, they're both similar, as mentioned before. They're both messenger RNA vaccines, and they both have 2 doses. And so with the Pfizer is 21 days apart, and with the Moderna is 28 days apart. And they're both similar as far as how effective they are. And then with Pfizer, it's a difference in the ages. It's 16 and older, and then with Moderna, it's 18 and older.
Okay. Thank you. Should a person request one over the other, and why?
Yeah, that is kind of a tough question. I've been getting that question in clinic, and I just tell them kind of just go with whatever is available since they're very similar.
Yeah, I agree with you 100% because at this point, the vaccine it's difficult to get in some places. So if you have the opportunity to get either one, I think you should take that.
Mm-hmm. But isn't it true that the Pfizer, you have to do 2 doses with the Pfizer, as with when the Moderna comes out, that's only 1 dosage? Is that correct?
No, the Moderna is 2 doses also.
Okay.
There was some talk, and I don't know if that was scientific talk or just chatter about only doing one of the Moderna doses, but it's not fully effective until you get two.
Right. So once again, those are things.
Right. Yes, that's something that was on the internet. Exactly. Yeah.
Right.
Yeah.
All right. What is the vaccine free? That's the next question.
So I work at MedNorth, and so far, I actually just spoke with my medical director this morning, and so far we are not charging patients unless they have insurance. We're just charging the vaccine administration fee, so just the fee to give it.
Right. Okay. And I think that's the same everywhere. I personally got mine at the county health department, and it was 100% free. So,
Right. Same for me when I went to New Hanover Hospital, mine was free.
Mm-hmm.
Yeah.
And the ones that are being set up in the community are free also.
Mm-hmm. Oh, good.
Okay. And free at the health department, like you said.
Are there vaccine requirements for travelers to the United States?
Right now, I don't think so. I did see something recently where it's going to be a requirement, which I feel like is already in place as far as like the testing, like if you had a negative test.
Is that to or from? Because I know a lot of countries, like we couldn't enter a few countries. So I don't know if we have the vaccine. Do you know if there's any more likelihood that we can travel?
Right, that part I'm not clear on.
Okay. All right. How effective is Sinopharm's COVID vaccine?
And that vaccine is studied in China, and I believe it's 86% effective. Yeah.
Okay. What is the stage of testing for the most promising COVID-19 vaccines in the U.S.?
And I think right now we're in phase 3 in most of our trials.
And what do we know about the long-term effects of the vaccine?
It's still a lot of the unknown. Yeah, since we're in the new phase of getting everybody vaccinated. Because right now we only got the healthcare workers vaccinated in our country, and now we're working on 75 and older. So that's pretty much where we are. And we kind of just started in December. So most of us are like at least 1 to 2 months out or less from getting vaccinated.
Yes. I think and I heard that in one county close to us, they've gone to 65 and older too.
Okay.
Can a pregnant woman take the vaccine?
Yes, that is a great question because it has not been studied in pregnant women at all. So we tend to go by 2 organizations, which is ACOG, which stands for American College of Obstetricians and Gynecologists. And then we also study, we also go by the Society of Maternal Fetal Medicine. And so they actually recommend that you can get the vaccine, but also share decision-making with your OB provider or your midwife or family physician, is necessary. To kind of review the risk and benefits, and definitely recommend it if you're considered high risk, like if you have diabetes or obesity or asthma. And it's also safe in breastfeeding mothers, lactating women, as it hasn't been studied to give in newborns yet.
Thank you. Okay, what side effects can I expect from the vaccine?
Okay, so most common, like with any other vaccine, sore arms, some fatigue, maybe like a fever. And so I got the vaccine, and my second dose, which was Pfizer, I received on January 8th, and I had the mild symptoms. And that's just let you know that your immune system is working to build antibodies, and they're all short-lived. Like they shouldn't last past 48 hours.
Right.
The majority.
I just got my Moderna second vaccine yesterday. And I still have a very sore arm, and I had some muscle aches and chills, but I'm starting to feel better already. So the symptoms they can seem like a lot, but they don't last very long. And like you said, that's just your body, your immune system working.
And I've heard, since I haven't had the shot yet, that it's replicate of the flu shot. So for those who've gotten a flu shot, is the similar side effects.
Right. We have enough trouble selling the flu shot because people think that we're giving them a flu sometimes. So.
Exactly. And I'd rather have mild symptoms because I never had coronavirus before. And so it's scary to think that if I did get it, the risk of being on a ventilator and our death. So I'd rather deal with mild symptoms any day.
Right, absolutely. Can children under 12 take the vaccine? I think you've already spoken to that before, but.
Yeah, right now they can't, but they are doing some studies in older adolescent, I believe around that age. So we'll probably know more in the future.
Right. I have an acquaintance whose children are participating in a study in Texas. Yep. Okay. Do people who have had the COVID virus fare worse with the vaccine than other people?
Yeah, I don't think so. I know the recommendation is to wait 90 days, especially if you have severe symptoms. And then there's also some research saying you can get it 14 days after the virus. Like there's higher chance of reinfection, like if you don't get the vaccine is the way I see it. But otherwise, it's relatively safe to get it after being exposed.
Excuse me. There's a lot of mistrust in Native American communities also. What can we do to help encourage them to take the vaccine? Advertising, any ideas about that?
Yeah, probably social media, kind of like what we mentioned before, and like radio, and like maybe having providers speak to like these faith-based organizations. Yeah, I think more exposure, the better.
Right, I agree. I had a patient yesterday actually who's Native and told me that he's getting his vaccine this weekend, and his wife. So I also think word of mouth, like if you get it, then you can tell other people and then they'll feel more comfortable with it. So we should talk about it in the community.
Yep.
Are there different side effects for the different vaccines, or are they similar?
I feel like similar. When the vaccines first came out, just looking at the research that I read, and even on social media with my colleagues, like at first it seemed like more people were having side effects with the second dose of the Pfizer, but reading about the Moderna, it sounds very similar from what I've seen.
Yep. I'm looking at questions that are coming in now on the Facebook Live. Sorry. So if I want the vaccine, what should I do?
So I would say contact your local health department just to see where we are, because it's also based on age and health conditions. And right now it's 75 and older. And like you were saying earlier, we are opening up to 65 and older too. And talking with your primary care provider as well.
Right, because we also have them at Wilmington Health, but they're in such high demand that when they come in, we are booked up like the next day. Yeah. So I don't know if it's the same at MedNorth. Is that just for your patients there that can get it, or is that open to everyone?
Exactly. Yeah, we had a meeting yesterday, and this is, I believe today is our second or third day, and it's 75 and older, and we are going to expand to younger. I know yesterday we said just our patients, and hopefully in the future we might can expand it to patients that are not ours.
So Ms. Bryant, what about the places you know?
Well, you know, like you said, the county has a number where you can call, schedule an appointment with the county. The hospital also has a number, but for some people, you can go, if you have a MyChart account, you can actually go through MyChart and register. And let's see, today is Friday, and I apologize. This week has really been, I actually helped put together a community event in 3 days, and it was a success. So I'm really happy about that. But what, in my experience from doing this, even when people go to MyChart, they don't know how to navigate MyChart. And so they look to people for people to help them do that. And I think the hospital started, they went to, there's a website where you can go to schedule an appointment for the Point Theater, because they were doing mass vaccinations at the Point Theater also. And I think the first day they did maybe 1,300 vaccinations at a time. So they have it really strategically set up to do the community, to help the community get vaccinated. But the county—
Was that mostly in underserved communities, where at the Point Theater in the community event that you planned?
The community event that I did, so a couple of community leaders decided to do one on the north side of town and the south side. And we were given, I serviced about 30 people today. Just like I said, it was a pilot drive-through program, because I felt like some of the seniors that I had been in contact with had a problem walking, standing, and like I said, they didn't know how to navigate through the system. So I was able to get their contact information, help with filling out the information so that it can go through the My Chart, and have them come at a specific time in order to get the vaccination. And that's basically what it was, just to make it simpler and easier for them.
Were you helping those who didn't have My Chart, like trying to help people who didn't have My Chart?
Some of them, a lot of people don't have My Chart.
Right.
Interestingly, the first person that was on my list, they were residents of Southport, and they drove all the way from DC. It was a woman and her husband, and the woman's mother, who was 101 years old.
Oh, wow.
So once again, for me, the issue is you have seniors who don't know how to navigate that system.
Right. Absolutely.
Or you have even other counties, there's not enough of vaccination going out, right? So they're creating a list or an appointment, and the appointment may be 4 months out. So once again, these are seniors trying to navigate and trying to get the vaccination. So I guess my question or my response would be, if there were more organizations, faith-based, community-based, social, trying to help seniors strategically navigate through that system, I think that it would help not just the hospital, the county, the healthcare providers be able to get the vaccine out quicker. It was told to me that even with Wilmington Health, a lot of people who went to Wilmington Health assumed that they would be contacted to let them know, you can come in and take the vaccination, but they weren't. And so it was open up to the community. So this was the frustration that some of the seniors was going through. So, and someone asked me, well, why do you feel so compelled to do this? And I always think, my mother, who is no longer here, if she was here, what are some things that I can do to make her life a little bit more easier? And I know for me, I wouldn't want to be sitting on the phone, 2 or 3 hours trying to get an appointment to get a vaccination, or even trying to navigate through a computer, which I really don't want to have to deal with. So, like I said, I tried to make it more convenient, not just for the seniors, but for the persons given the vaccine, to make it quicker and easier to navigate through.
Oh, thank you. What's the name of your organization? Or was there a name, or it was just a group of?
Well, my nonprofit is called Northside Bridge Builders, and I try to work with all the Northside organizations, nonprofits especially. And I know Dreams was the site that we did this at, and I thank Dreams for being able to do this, where we've had drive-through events before. So this was, like I said, a pilot program as to how we can do it quicker and more efficient for those who need to get it.
And who actually gave the vaccinations?
New Hanover had their community paramedics come out and do it.
Oh, wow.
So we had a pharmacist on site, we had the EMS on site, and we had hospital volunteers and workers to help do the vaccine. And then I had volunteers that we wanted to make sure that it runs smoothly, have them come in, check the people in, and verify all their information and keep it moving. And you know, once you get the vaccination, you have to wait 15 minutes. So the hospital had persons on site to make sure that as that 15 minutes was elapsing, that the people were all right and they could leave.
Why do you have to wait 15 minutes? You know, Dr. Beatty, you want to speak to
just
that?
to see, just to see if you have like a reaction.
Okay. What are contraindications for the COVID vaccine?
Like if you had a severe anaphylactic reaction, that would be like wheezing, like life-threatening symptoms.
Okay.
To a prior vaccine.
So for those who are not in the medical field, what was that word you said again? Anaphylactic?
Anaphylactic.
Yeah.
So I was filling out a form and it had that word on it. And I said, okay, so what does that mean? Allergies?
Yeah, wheezing, shortness of breath, like severe life-threatening symptoms is why I tell patients with any
you
vaccine.
might have, your lips might swell, your tongue might swell, feels like you can't breathe. Yeah. A very severe reaction.
Yes.
So they should put that, a very severe reaction instead of anaphylaxis on the form, right?
That you have, if you had a flu shot or a vaccination, you have to wait 14 days prior.
Yep. Any vaccine, any shot, 14 days.
Right. That's a lot of my patients are getting in that with getting the shingles vaccine, and then you know they have to wait before they get this vaccine too.
I have seen some cases where it did happen, like they received the injection anyway, like it wasn't caught in time. And so per CDC guidelines, you just continue with the second dose as scheduled. Like it's nothing extra you have to do.
So we had a lady that came in today and she has asthma. And so she said, I'm going to make sure I bring my EpiPen. But like I said, we had persons on site that just in case something happened, you know, they would be prepared to take whatever measures needed to be taken. But I thought it was interesting. She said, I'm going to take the vaccine, but I'm bringing my EpiPen.
That's why it'd be good to discuss with your provider, because then they'll monitor you for like 30 minutes. And some providers might choose to do prednisone or Benadryl. So it all depends on that reaction.
The next question was, once vaccinated, do we have to keep wearing masks and social distancing?
Definitely. Yes. My second dose was January 8th, and I'm still wearing mine. Because with that first dose, 2 weeks after the first dose, you're only 50% protected. Then 2 weeks after the second dose, you're 95% protected. But just know it's really when we reach herd immunity, when most of the population is it's vaccinated.
So we can still continue to transmit it, even though we wouldn't get the infection. So the herd immunity is a really important part. Is the county prioritizing Black people of color for the vaccine? You have any information on that, Ms. Bryant?
So as I know, I try to stay in contact with the county to find out what they're doing. But yes, they had some community events set up to strategically target the African-American communities, because in realizing that initially these are the communities that were hit hardest. And it goes back to what strategically making sure you get the information out and the education part out. So we did have one person I know of that was strategically making sure that there were vaccinations set up through the county in the African-American community.
Very good. I do remember when I filled out my form also, they did ask if I had any comorbidities that make me an increased risk of having a severe COVID reaction. So they asked about weight and diabetes and cardiovascular disease and being immunocompromised and things like that. How long will the vaccine last? Will it be a yearly shot or monthly?
Yeah, right now we don't know yet. Yeah. That's a great question. A lot of us have that question ourselves.
The question is, when will the vaccine be open to people under 65 who are non-essential workers? And it is open to people who are, I'm sorry, over 65, but not under 65. And I'm not sure about the under 65 part.
Right.
Yeah, so from what the information that I've gathered, we're in what, phase 3?
I thought we were in phase 2B.
Yeah, phase 2.
So that's 65 and older. So if I'm not mistaken, it's 4 phases. So this is phase 2, 65 and older. And then the last phase would be open to everybody, correct?
Right.
Right. So, and what has been interesting to me is that, like I said, I think that what's missing is the educational piece. It was explained to me on yesterday that, and I'm gonna give an example, some people that worked in funeral homes, that they were supposed to be on the first round, right? Phase 1. Mm-hmm. And I know I had came across about 5 or 6 people who were funeral home directors or workers who never got informed of this. So now the question is, well, can I get it now? My response after doing some research and asking the powers to be, yeah, you can, but once again, you got to go through that system of scheduling an appointment and working like that. I have a sister that lives in another county. Her problem is she's 68, and what was told to her was that even though you're 68, it's not technically open to you yet because we're still working to get those persons that are older than you vaccinated. Yeah. So it's just mixed messages being told. Right. I got a call earlier, my grandmother's 88 years old and she hadn't had the vaccination. How can she get it? And so people are thinking that, well, the first phase was for 75 and older, so they can't get it anymore.
Right. Oh, that is, I can see how people could be confused by that. The other thing that people were talking about is that there's always a busy signal when they try to call the county's phone number. And I wish that Carla was here to speak to that, but she's not. But I do know, I have a friend who dialed that number 168 times one day to try to get her mother in to get her vaccine. And she did succeed in getting her the vaccine, but that was a lot of work and that must have taken all day long.
Mm-hmm. So imagine if I'm 88 years old trying to do that.
Right, yes. So the next question is how typical is that reaction? This question came through when we were talking about anaphylaxis. Do we have any idea about the numbers, the percentage of people who have anaphylaxis from the vaccine?
They talk about from the COVID vaccine in general? Yeah, I'm not sure.
Okay. And I have a couple of comments that the current administration is working on a COVID-19 strategic plan to help with getting more vaccines administered. I think, excuse me one second. I'm sorry. I will be right back.
So just knowing that even with the vaccination or the vaccines, it's my understanding that it's not coming down the pipeline quick enough. And so that's some of the struggle that people are having when it comes to scheduling appointments, or why their appointments are maybe further out because they don't have enough of vaccines coming in quick enough in order to make sure that the community get vaccinated.
Right. I think the goal now is to have 100 million people vaccinated by, but this is very recent information, so I'm not 100% sure about that. The next question was, if I've already had COVID-19, do I still need to get the vaccine?
Yeah, definitely recommend it because there's chance of reinfection. Right now, the guidelines is at least 90 days since you already have antibodies, and that's just to get our other people vaccinated that haven't had the virus yet. But yeah, you definitely get it.
If you have heart problems or underlying health conditions, can you get the vaccine?
Yes. And we're actually recommending it for all of our high-risk patients, especially because you're at more risk of having more complications with the coronavirus itself.
And I think you answered this earlier. What percentage of the population needs to get vaccinated in order to have herd immunity?
70%.
Okay. Let's see. I don't really have any other questions. Would you all like to add anything?
I would just say, you know, for those who are out there who, I saw a question about, you know, what measures can I take in order to keep from getting COVID prior to me taking the vaccine. And so once again, it's washing your hands, social distancing, wearing your mask. I think that that's important. And more important, I think early on, someone asked me, well, are you going to get the vaccination? Well, yeah. Because, you know, I love to travel. I haven't been anywhere in a while, and I'm about to, you know, burst out at the seams because I'd like to be able to travel. I'd like to be able to go see my family. But more importantly, the people that I'm around, I want to make sure that I'm protected and I'm protecting them also. I have a brother that is in a nursing home, and unfortunately, even though I can make an appointment to go and see him, I don't want to put him at that risk, and I don't want to be at that risk also. So, you know, we have to really think smart about, you know, not just us, but the people we are around. I know that if I was in a household, I'd recommend my entire household getting vaccinated to make sure that we are safe. Because how do I know that after the taking the vaccination, it's not another strain out there? I can't get sick again. So it's just a lot that we as adults have to make sure we educate not only ourselves, but the community in the importance of staying safe.
Thank you. Dr. Bates, would you like to say anything in summary about how we're going to get this out to the community or anything else to encourage the community to get the vaccine?
Yes, I would say get vaccinated when you can so we can end this pandemic. It's so important to protect our health. And if you have any questions or concerns, even after this session, you know, feel free to reach out to any one of us, or your medical provider would be ideal, or even at your faith-based organization, like your preacher or relatives, if you're still having concerns. Like even asking other people that got the vaccine, like what was their reaction? Would be helpful. And my goal definitely is to educate more and be more involved in social media and community events. And I definitely want to get a pen to let my patients know that I am vaccinated. I try to mention it every visit, and just try to educate as much as I can.
Very good. And then also, I'd just like to add that until we get to that herd immunity that you talked about, we have to continue to be careful. So just continuing social distancing and mask wearing. And just like you, I've had my vaccine, but I always wear my mask, and
yes.
I still don't go out to restaurants. So. Okay, well, thank you all very much.
You're welcome. And, you know,
go ahead.
Put out the numbers again, you know, the county, then the hospital has a line, and then you can go to my chart if you have access to a computer to make sure you register to get the vaccine.
Thank you. We will be doing this every third Friday in the month, and we will address other health concerns depending on which month we'll be speaking. Thank you all very much for coming and participating and sending your questions. And thank you, Ms. Bryant.
Thank you.
Thank you.